Hello, Barnaby here. It's another HelloLife moment for you because we're all about making sure that you have great support in your journey towards a better life through the use of natural medicines and supplements. And so we're going to be talking about some over-the-counter medication here. Dr. Jeffrey Chamberlain, family doctor, who joins me often here on this HelloLife. So let's talk about it. Acetaminophen, ibuprofen, aspirin for kids. Take us through the thicket. Let's start with the things that you shouldn't give your kid.
Okay. Aspirin is a biggie. Never give children aspirin. There's a thing called Ray syndrome that it's a serious life-threatening illness that children who take aspirin and have a fever can develop it. And so that's why in the late 1970s they figured this out, and they said never give aspirin to kids. And there's a lot of parents who still don't know this, a lot of grandparents who don't know this, but it's just important. Never ever give aspirin to a child.
So it could be argued, should you give a child acetaminophen if they have a fever? It seems like a drug that has probably some side effects.
Okay, that's what all medications have side effects, and that's why we really have to ask ourselves, does a child really need this medication? Is it something that we're using to get rid of a disease or help them get better faster, or are we just covering up some symptoms that maybe we don't even need to cover up in the first place?
But if the child is complaining, necessarily we as parents want to do something about it, but there are some real downsides to things like acetaminophen, especially in the liver area.
Yeah, that's true. Acetaminophen at high doses can cause permanent liver damage, which is a serious, horrible illness to live with, and it's something that can be life-threatening. And so if you are going to use acetaminophen, always use only the recommended dose and don't never use more than that.
And that would be for fever reduction predominantly.
For pain is the main thing. The American Academy of Pediatrics has recently put out a statement saying that they don't want us to treat fever. The actual studies show that the fever itself doesn't cause the problem. It's the illness that's causing the problem. And so if a kid has a fever but they're relatively comfortable, we don't need to use acetaminophen. If they're really uncomfortable, then we might think about using acetaminophen.
Boy, that is going to be a tough habit to break for parents, just wanting to give their kids something. Now, ibuprofen, what would that be good for a kid?
So ibuprofen, it does reduce fevers, it does help with pain, and it's anti-inflammatory. And so a lot of times if it's more of a sports injury or inflammatory injury, the ibuprofen would work well for that.
Now, it's interesting, you were telling me earlier about kids, a study done about fractures and the use of either just straight pain medication like a Tylenol versus Tylenol with codeine. And what were the findings with that? It was kind of surprising.
Yeah, there's a study published about a year ago, and they took kids with fractures, kids from about 5 years of age all the way up to teenagers, and they split them into two groups. One group was given acetaminophen, and the other group was given acetaminophen with codeine. It was blinded, so the kids, the parents, and the doctors didn't know which medications they were on. And these are kids who had fractures, so there's a serious amount of pain that they're in. And you would think that the people on Tylenol with codeine would have had a much better pain reduction, but when you looked at their pain scores, there was no difference between the acetaminophen and acetaminophen with codeine for pain. But interestingly, the kids who were just on acetaminophen and didn't have the narcotic with it had a lot more functionality. That means they were going to school sooner, they were enjoying themselves more, they were playing games more, they were up and moving around more than the kids that were given the codeine.
Wow, it is amazing because we are all of the belief that drugs give you a better life when in fact the fewer drugs the better, probably, because the body knows what it's doing when it comes to healing.
That's true. When we're taking care of pain, especially with kids, the body knows what we're doing. Adults are the only animals out of all of them that will keep going when they're in pain when they shouldn't be causing more injury. All the rest of the animals and children are smart enough to know that if I'm in pain, I'm not going to do anything. But if they aren't in enough pain, they'll do what they can do. And so you can actually go without pain medications in a kid a lot of times, and they'll modulate their pain levels just by their activity. If they're in an acceptable amount of pain, they'll do more. If they're starting to feel it a bit, then they're going to back off. And so they'll take care of it themselves most of the time.
Well, I'll tell you what, better health, better role as a parent, it's all right here for you every time you click on HelloLife.net. Thanks a lot, Doctor.
You're welcome.